Hello, my name is Geoffrey Yamauchi with Habibi's Home Medical, and today I'm going to show you how to use our wrist blood pressure monitor. This is the nice thing about this is it's a lot smaller than the cumbersome table models, which we also do sell, but not quite as accurate. But that's okay, because what we're really wanting people to do is take their blood pressure on a more consistent basis and use this thing on a daily basis if they can. So it takes the common AAA batteries, which slip right in and turn right on. Now, to use this, you're going to use this on your left wrist. It's important that you use it on the left wrist. The right wrist will provide you too high of a blood pressure reading. So you're going to take off your watch or any jewelry that you might have, slip it onto your left wrist, right about here, tighten the belt buckle around it, and then you push the red button. You're going to want this at heart level. What I like to do is I suggest that you sit in a comfortable chair or a couch with a high arm on it that you can rest your arm on, because if you're moving your arm around, you're going to get higher than average readings. Also, you're going to want to not talk during this time or do strenuous activity or smoke cigarettes or be having your blood pressure monitor or your blood pressure medication right there at that particular time. Generally, you want to take your blood pressure at the same time each day. I would say probably twice a day that you want to take it, between 6 and 8 a.m. in the morning and 6 and 8 p.m. in the evening. These are your best times to take it. So after you've put your batteries in, you can set the features on this so that it records it, but I always encourage people to keep a pen and paper to keep their results. Quite simply, you turn it on and it does all the work. It pumps up on its own and it gives you your reading. I had it on already, but it'll give you your reading within a few seconds. It's very quiet, pumps up, and then it slowly starts letting the air out as it checks your pulse as it's doing it. All right, it's a little bit high for me this morning at 126/73. That's after a couple cups of coffee though. And we do like to turn it off and you're ready to go on with your day. It's a quick and easy way to keep your blood pressure and to know what's going on with maybe your medications or how you're doing in general if you've been feeling lightheaded or suffer from the potential of stroke. Hope we'll see you guys again. Have a great day. Thank you from Habibi's Home Medical.